Hey everybody, how's everyone doing today? Boy, it's a nice balmy 2 degrees out here in Boston, Massachusetts, and nonetheless, we still had an amazing MGMA meeting this morning out in Waltham at Babson College. And this topic, I was so excited to book these speakers. So we had the person who's his name's Jonas Bromberg. He's PsyD, who is responsible for all of the children's hospitals, PPOC division, implementing, really integrating behavioral health into all the pediatric sites. They have, I think, 87 sites, and they've integrated it successfully into 75 or so over the last few years. They're committed to banging out on all of them, setting up just this awesome model that most people who right now, if you're parents and you have kids that are going to the pediatrician, most of them are not set up like this right now, but these guys are very aggressive. They're really leading the way in Massachusetts anyway. So how to integrate behavioral health into your practice, and this of course goes for adult medicine as well, and the need is gigantic. So you have in medicine, the clinicians are taught, maybe about 5% of what they're taught actually has to do with behavioral health. So understanding for what the signs are to tell if, for instance, anxiety in a 4-year-old versus anxiety in a 14-year-old are very different to diagnose, to determine, and to treat. Most clinicians, your pediatrician likely does not know how to identify it, almost certainly, or to properly treat it for sure. So if you might have integrated behavioral health if your pediatrician has one of those checklists that have a lot of questions about what the home life's like, about anxiety and depression, and those checklists usually are often to refer to a psychotherapist, but in an integrated behavioral health practice, that therapist, whether they're a mental health clinician, if they're a social worker, if they're a psychologist, whatever the profession, whatever their degree is to properly triage these patients to the right match to be able to deal with an issue like that. And instead of anyone that understand mental health is one of the highest demand, lowest reimbursement for sure specialties in healthcare. The only thing that's even similar is dermatology. So whenever you book a dermatology appointment, or if you're trying to book a mental health visit, the waits are often 6 or 8 months or something crazy like that. So in these practices, now you're looking at maybe you can see somebody in 2 to 3 weeks. And if something turns out to be a larger issue, very impactful, significant issue, then certainly you will still be referred to someone that's much more specialized in what it is that you're going through. But generally speaking, a lot of these, for just to give you an example, for every 4,000 patients or so, of course, depending on your demographic and whatnot, what insurances you're taking, that can certainly skew the numbers. But basically, every 4,000 patients that you have, you can have a full-time behavioral health member of your team, and it's very difficult. You're dealing with if you're in pediatrics, you're used to sending out referrals, not actually processing them. Never mind processing internal referrals from other members of your practice. So there's lots of pieces to the puzzle that you have to learn. I got a great understanding of that. For 75 minutes, not only do we hear about how it's improving outcomes, how it's saving money for payers, even large health practices, and it's not a huge money maker, but it's definitely evening out. Even we're seeing ED rates are just not climbing as fast as they typically would. They're maybe evening out a bit. We're seeing on the granular level, on the actual implementation, we had Carol O'Neill from Westfield Mansfield Pediatrics, one of the largest and most successful pediatric practices in the state of Massachusetts. My daughters happen to also attend there. And they have 3 different locations in Massachusetts. They are really kind of one of the practices that are leading this movement too. Gosh, we're already over 5 minutes. Wow. All right, I'll wrap it up. Anyway, so there was an amazing educational session. Happy to discuss if your practice is looking to understand what the pieces are to take on, or what the benefits are. Happy to talk to you more about it in depth. Just send an email over to tim@doctorsmanagementservice.org, or you can call me at 508-238-8646. My extension is 670.